About 10 years ago, I made my way back to California after decades on the East Coast, serving in the Department of Defense, the State Department. Was also a business owner, enjoyed some success. But it was time for me to come home here to my native state and reconnect with my family and to pursue or to entrench myself into a lifestyle of, we'll call it semi-retirement. And about 2 weeks after I got back here, a new acquaintance of mine suggested that I head over to the old hospital, now the support services campus, talk to the grounds manager there, and check on a possible job. He knew that I liked gardening and landscaping, and I was at that point in my life where I could do what I wanted to do, and I like to garden and landscape. So I head over there, and the interview went something like this. Hi, my name is Mitch. Are you hiring? And the response was, can you start tomorrow? And it was a little easier to get in back in those days. But so I get hired, and I'm a per diem groundsman. And I am the fifth man on a crew of 5. So I'm low man on the totem pole. But, you know, I'm semi-retired. I am working, doing the kind of work I like doing, and I'm living the dream. And part of my responsibilities is to head up to Selma twice a week and take care of the grounds up there. You know, mow the lawn, pick up the trash, take care of the planter beds, do some pruning. I mean, that's a good day for me. That's therapeutic for me. And so while I'm up there, I make some friends, and among them, we've got a young lady from administration. We have a couple of pharmacy techs and a nurse from the emergency room. And I thought it was cool that they let me hang out with them on the breaks. And we'd get together by that big pine tree just outside the front doors at the main entrance of Selma Hospital. 2 times a day, Tuesdays and Thursdays, for 10 minutes, our little social circle. And so on one gorgeous spring morning, we gather for our morning break. We're a couple of minutes into it. And all of a sudden, very abruptly, almost rudely, the loudspeakers start making an announcement that sounds kind of like this. Attention all emergency personnel, GSW incoming. And with that, they were gone. My little social circle, poof, they were gone. I had no idea what was going on. I figured, well, okay, break time's over. I'll go back to what I was doing. I just so happened to be working on a planter bed over by where the ambulance comes in. And you know, the new, or relatively new, imaging center there, Mr. and Mrs. Brown donated several years ago, that wasn't even there yet. And so I'm over there, and I'm back to my duties. And boom, here comes the ambulance. Sirens, screeching, the whole thing. And I'm like, from me to the front row, away from this. Got a great view of what's going on. And the doors of the ambulance open up, and I see the patient, and then suddenly light bulbs start going off. Sadly, I've had plenty of experience with GSWs, and I finally realized gunshot wound as I saw this patient. And about the time I get that figured out, here comes that nurse who I was just chatting with a minute ago. He busts through the doors, hops on that gurney, straddles that patient, and he's going for broke. Doing everything he can to save this patient's life. And in that snapshot of a moment, everything just froze and stopped for me. Slowed way down, got real silent. Now, most of the time, I need somebody to lift something heavy and throw it at my head to get my attention. But this was a little different, because I found it so remarkable that this nurse was selling out, given everything he had, was fully committed for saving that patient's life. And all the people around him were all focused on taking care of somebody they didn't even know 2 minutes earlier. And I found that absolutely amazing. And I knew God was talking to me right then and there, saying, Mitch, this is where you need to be. You need to be around these people for your own good. So that day was 8.5 years ago. And I'm really so thankful that God would put me here to work with folks like you, the people in this room, who practice compassion without hesitation every day, every encounter. That's very inspiring to me. So, if you want to know how my retirement's going, I can say that without any hesitation, by God's grace and by the continued work of the people I get to work with, I get to witness my retirement's going better than I ever could have dreamed. Thank you.